Hey, everybody, it's Teepa and
Rachel.
Yeah, we're together
in person.
It's been a long time since we've done that. We're in Indiana, Indianapolis sort of area. We did a talk today with senior care companions, and that was we had 3 different programs that we did today there. And tomorrow we'll be at Joy's house in Indianapolis. But this evening, it's actually Thursday evening, even though you're watching this Friday morning. I know it's a little confusing, but that's the way we roll. It's disorienting times 1, right? Different place, different time. Tomorrow morning we'll be busy, so we'll be doing this tonight. We wanted to check in with something that comes up when carers, like somebody who's a care partner, feels and believes that something is going on, and they try to share that. Okay, so we'll do a little role play. First, we'll do it as there's a medical provider. And the difference between feeling supported and validated and the way you might feel when somebody discounts or dismisses or doesn't think that your reporting is accurate or has value. So we're going to do it. We'll do it as a medical provider, and then we'll do it more as a friend or family member. So you get a feel for what we're talking about. So Rachel, what is it you think is going on with your mom?
Well, I've been noticing some things, and she's just not acting like she used to act, and she's forgetting things, and she can't come up with the names for words. And, she's always cooked in the kitchen, and she's making some mistakes.
Okay,
there.
Rachel. Okay, so
well, she's also been falling.
What do you mean she's been falling?
Well,
she get hurt or not?
Well, I mean, her knee got all messed up.
But yeah, but was she out walking on this pavement or on the sidewalk or something?
Some different things. It'd be like a little step or walking.
So Rachel, I'm going to pause you because I checked her all blood values. I checked her labs. I mean, there's really nothing going on with her that's abnormal. So, I mean, yeah, she might be having some small changes. I mean, at her age, we've got to be looking at what's possible. But you're really creating something like much more dramatic than what it is. And I need you to really take a step back and just realize this is aging process. And maybe she has a little something going on there, but there's nothing I'm going to do dramatically about it. So, do you need some help? I mean, is it getting to be too much for you to be taking care of your mom and supporting her?
No, but I am telling you, I know my mom and I know what's normal for her, and this is not normal.
All right. So what do you want me to do? Some more labs? You want me to run more tests?
Well, how about if you give us a referral to a neurologist?
A neurologist? What do you think a neurologist? Okay, so I'm going to pause. So Rachel, how are you feeling right now?
I'm really frustrated with you. Not only did you not listen to me, now you're acting like I'm the problem.
So why could things like that happen, do you think? Why do things like that happen? Because it's not could happen. They do happen. What do you think is going on?
I don't think that the doctor really knows what to do. So the only way to deal with it is to discount me, because unless it's really serious.
Well, what did I tell you that I'd already done?
Well, you'd already done lab results and something else.
Right. So I've done the thing I really know how to do. And if there's something more you're looking for, unfortunately, I don't know how to deliver it. And that's really not because I don't know what to do to make it better. I don't see how there's anything I have to offer from a medical or a support perspective. But what happened was more than that.
You made me feel like I'm crazy and I'm making stuff up and I'm making a mountain out of a molehill, and that's even worse because you discredited me. Basically said I didn't know what I was talking about.
Well, and I think the issue is when we talk about things like dementia, where it's a day-to-day life impacting condition, and we're asking somebody who, unless they've done some special training in geriatrics, unless they've done special training in working with chronic illnesses, where people really are having to figure out how to live, how to cope, and in addition to that, have worked with a triad. So you're not just working with the patient, which what providers are often used to doing, but you also are working with a partner of the patient, because the two of them are both living with the condition. One on the inside and one on the outside. And so what you're getting are 2 very different perspectives of the condition the person is living with. And what sometimes happens is I'm just so used to this that I don't really want to hear that, because I mean, unless I can medicate that person or do something treatment with that person, what am I supposed to do? And so from my perspective, you're right. I do feel like there's not a lot I can offer you. I mean, if it is dementia, there's still not a lot I can offer you. If she's getting worse, there's still not a lot. If you've reached your limit, then we need to look for placement. Is that what you're looking for? And like, well, that wasn't what Rachel was really looking for. So part of the issue, I think, is this the right place to bring this? A medical provider for what you're experiencing.
Not if that's the answer I'm going to get a response.
So this is the tricky part, because until you experience this phenomenon, it could feel like, well, I should let the doctor know that we're having more issues. There's the falls. Well, she skinned her knee. It's like, well, there's a high probability of falls with dementia. And it's like, the tricky part for me is, I don't know what to tell you to do. I mean, there's not like a lot that I can offer, but we don't have a plan for where to have Rachel go. And we don't really have really good support structures for people like Rachel living in this situation. And so if I had a little more ability and skill, I might say, so Rachel, what I hear you saying is there are a number of issues that are starting to come up with you and your mom. I think it's time to make sure that you have good support structures in place. So are you connected to either a support group for you? Is your mom in a support group? Are you guys getting some education related to how to help with her dementia? Or whatever might be going on. We aren't sure it's yet dementia, but it sure is drifting that way. And I've done everything I know to do to evaluate other causes. So unfortunately, I think we're looking probably in that direction. Have you done anything?
That's kind of what
yet?
I'm thinking,
Mm-hmm.
as much as I don't like it.
As much as you don't like it. Yeah. So I'm wondering if, given what you're experiencing, which is getting harder, you're having more things with your mom, you're really struggling some to try to figure out how to be supportive. The falls, it sounds like, is she seeming to have some safety awareness issues, or? Sounds like she's pulled back. Sounds like she's pulled back from doing things more than, like, she's not cooking as much in the kitchen. She's making a few mistakes, but more pulling back from doing things.
I'm doing more.
You're doing more. So yeah, it may be time to really start looking for what local resources there are. And you might try the AAA to start with, Area Agency on Aging, who has often a family caregiver support person that you might be able to work with. It might be worth checking in with the Dementia Support Association in the area, if there are any that are active. Maybe looking online at some of the resources that are out there, because it's starting to seem very real that your role in this could be more than has been so far. And your mom might need some support. So does that feel different?
Way different.
Way different. And yet I didn't really do a lot more than I did the first time, other than I acknowledged, I recognized, I verified. Yeah, this feels really different. So I guess the question is, how do we get more care providers into this way of doing things? Because without this, Rachel comes to a care provider and the care provider doesn't help. And so it reinforces just, well, I guess you just have to keep going. I guess you just have to keep trying. I mean, there wasn't any suggestion the first time that there were resources out, and it was time to start looking at them. And nothing for mom, no recommendation. So I wish I could say that I think we're making great inroads with all the care providers, but I'm not sure that we are. I think what we might be able to do is help someone like Rachel recognize, okay, well, this wasn't the right place to come. So now it's time to start looking around for other places to be. But it also says there's something wrong with the system. If we look at it this way, And if we aren't liking what is, we're going to have to create what we want ourselves, because it doesn't appear that there's a rapid transition of really providing this. So Rachel needs some verification, some validation, some recognition that she is accurate in her perception that things are changing. Once she gets that, then she's going to be better able to move forward. You can't really move forward if you're being told that, well, if it is, it's not a big deal. It is just what it is. That doesn't encourage someone to move forward into action. And so what's the difference between validation and not validation? Action. Because once you get validated, then you have some impetus to move somewhere, to do something, to change something. And you might actually have one or two suggestions that could help. And if not, maybe it empowers you to go find someplace else where you do get help. So that was today's session, and it was really focusing on care providers. And if care providers are not providing what you're looking for, try not to take it personally. It's hard, but try not to take it personally and say, okay, pause. This person isn't able to deliver what I need. I still have unmet need. I am going to seek out someone who could do that. So possibly you could get up with us. If it doesn't work to get up with us, there are other resources. I mentioned some, AAA, caregiver support, dementia agencies if you want to look for something else. But I would encourage you as a care partner, someone who does partner and is feeling flustered and frustrated that things are changing and you're not hearing support from your provider, raise your hand and say, I could use some help. And we'll do our very best to see what we can come up with. But also recognizing the person you care for might also need some help. And maybe that's a whole nother area to explore. And maybe the two of you together, or maybe two of you separately to start with. But you deserve to be heard, you deserve to be listened to, and your concerns should be validated. Because without that, you're living with dementia on the wedge. That is not a good place to be. Rachel, anything you want to add?
I was thinking that when we run into this dead end, that as far as being an advocate, that as hard as it is to not take that for any time to be shut down and kind of go look for other avenues, like Teepa was saying, so that it is hard because you feel like you're basically made to feel stupid. That's really kind of what it makes you feel like, or crazy. And so to not let that stop you.
Block you. Yeah. Mm-hmm. Just because I put this up, it's like, okay, well, quit looking at my hand and go look at other things. Quit just pay attention to me, because my answer to you is, I don't know what to do. And it's like, okay, it sounds like you don't know what to do. You could be bold and even say, sounds like you aren't sure of anything you have to offer. I appreciate you listening. I'll go look somewhere else. Thank you for not being particularly helpful. But until we start doing things like that, I think we're going to continue to feel overwhelmed and disrespected. The work you're doing is really important. The observation you're making, somebody should be listening, and you should get some support. So if it's not here, keep looking. Tomorrow we'll talk about when someone says to you as a friend, as a family member, I have noticed some changes. What the options you have are as that family member or friend who could offer support. You don't have to agree. You don't need to disagree. What you want to be is a support. So till next time, take care with your care. Hey, everybody, it's Teepa and
Rachel.
Yeah, and we're in Indianapolis still. Well, by the time you see this, we won't be in Indianapolis, but we are right now. And we were going to do the second in the series of validation of a care partner who's noticing some changes. And we just have a visitor at our door who obviously was surprised that it was not who she thought it was going to be when I opened the door. And her whole face, body was like, whoa. And it was like, not who you expected. And so sort of like that, where, something unexpected happens and the person on the other side of the door doesn't know quite what to do with it. So what I'm going to do is be someone who is not getting what Rachel is trying to share and is not sure what to do with it. Because my experience is that that's, I'm not experiencing that. And so because I'm so not experiencing what Rachel's experiencing, I am really committed to it probably isn't anything because I would notice if it was. And so I'm having a hard time believing that I wouldn't notice if something were going on. So I think Rachel has got to be
Crazy.
wrong, at least wrong. I wasn't going for crazy. I was just going for wrong because I'm very observant. So before we even do the role play, Rachel, how are you feeling about me?
I'm not looking forward to this.
It's not going to be a lot of fun. But we go into relationships sometimes not realizing that the other person can't see it the way we're seeing it. And if that's the case, both of us have potential to make mistakes here. What's really tricky about this is I have to decide as a friend of Rachel's, as a family member of Rachel's and of the other person, what's my role? And I could be a denier. In other words, Rachel, it's just not that big a deal. I mean, I would know if something were going on. Or I could decide I'm going to be a supporter, or I could say, well, I just don't see anything going on. I mean, if you're worried about something, you should get it looked at. But that doesn't feel particularly supportive. So we'll do a little role play to show you what it might look like if I really do not believe what Rachel is saying. I mean, I haven't been experiencing it, and I'm committed to sharing back my point of view to Rachel. And that's very different than validation. So what is it that you're thinking is going on?
You're not?
No, I mean, I talk to her pretty regularly on the phone. I mean, she might be missing a word or so, but it's not any big deal. I mean, we can always get through. I mean, she says, I've been out, I've been doing stuff. And I say, what? And she says, oh, out in the yard and then to the garden thing. And then, so I'm not having trouble having conversations with her. And it sounded like from what you said, you were.
Well, I can talk to her. I have conversations. Fine. It's just I'm noticing that she's having a lot harder time communicating her ideas. That when she comes up to an idea, it's like it disappears on her. She's pulling back from stuff she's enjoyed, like being with people and doing things. The things she used to enjoy, she doesn't. And now I'm
Rachel,
noticing.
You may be asking too much because I will tell you that, she is getting older.
And I know she's getting older, but these are things that she's always liked.
Well, but always doesn't mean always. I mean, people can change. And she says her arthritis bothers her a little bit more. Maybe that's what it's about.
But this isn't just a little bit. Like, this is a major change for her.
I don't think it's a major change. Why do you think it's a major change? Okay, now
she's always like being around people.
Is this starting to sound almost like an argument?
It's really like one.
Yeah. Well, that's because I'm so committed to my perspective, my point of view.
You're not listening.
Well, neither are you. The tricky part is which of us would be willing to switch positions to be supportive. And it's sounding like because Rachel is often right in the middle of this, she's doing it 24/7, or at least most of a day. I'm doing quick check-ins. I'm checking in. I'm trying to be supportive, but I'm actually not trying to be supportive. I want my perspective in it. So I'm going to switch and I'm going to say, okay, you know what? For right now, I'm going to just really verify, validate, and I am going to support Rachel right now. Doesn't mean I'm going to agree with everything, but I'm going to be supportive. So let's see what that might look like and how that might change something in what's going on. We won't know till we try. So Rachel, sounds like you wanted to talk about some of the things that are shifting or changing.
Yeah, I was curious. What are you noticing? Have you noticed anything?
Not a lot. I mean, I think when I talked to her, she's a little more vague, but I don't necessarily expect her to be, because it's the same thing. She does the same thing the same way most day after day. So, I'm not seeing a big change.
Well, it's interesting because that's a little different than what I'm seeing.
Okay. So it feels real different. Talk to me about that.
I don't know that it's like real different. It's just I'm noticing changes that seem out of character for what's been normal for her. and not just in the far, far past, but in the more recent past.
Recent past.
And so I feel like she's pulling away from some things
Uh-huh.
that have been the consistent routines of she's always done this. And now I'm getting a lot more pushback of no, I don't really want to.
And so
Or
have you talked to her about it, or you raised it up with her, or asked her about why she might be pulling back, or?
I've kind of tried to ask and I haven't really gotten any clear ideas. I get excuses and I don't know if the excuses are a cover up for why she doesn't want to go or if there's another reason for it.
So it sounds like you have tried a couple things, but it's not working. Can you give me some examples of what you've tried with her?
Well, you know, she'd have like a lunch group, she'll know with the ladies and she kind of she'll say she'll go until like the day of or not too long before. Then all of a sudden it's like, oh no, I just don't feel like it today. And so and I can't get a good reason why not. It's just no, I don't feel like but then it'll be like, oh yeah, I'm gonna go. Oh, I'll go next time. But then no, and this has happened
So
several
it's
times in a
happening
row.
several times. All right. So it sounds like you've tried one strategy or so to make it different, and that didn't make it different. So you make me wonder whether or not what you're trying to help her do, she's overwhelmed by. Like it's too much. And that's why she's putting her feet down and pulling back. I wonder if meeting with a group feels too much. I wonder what would happen if you tried maybe just meeting with one other person, maybe you guys going out to eat and just meeting up with one person versus
Just to see if it changed.
just see if it was different at all, because you've identified something's different and you've identified she's starting to really push back from the group. And you've talked about it, some it doesn't seem to have changed anything.
But she doesn't really acknowledge that. She won't really acknowledge that she's pulling back.
Right. And that's why I'm saying maybe just having her go out with, and running across a friend or meeting up with one friend. But you guys going out together. I mean, is she not going out at all, or is it just not meeting up with friends and wanting to go out and be with
She's
friends?
not wanting to go out as much.
Okay. But
She'll stay home, like she'll send me to go to the grocery store. She'll send me to go do whatever.
And so
And
you're
she'll
getting
stay
into
home.
that habit of doing those things.
Well, I'm not sure what else to do.
You're not sure what else to do. So it makes me wonder whether it's time to look at the two of you and maybe think that maybe a third person to give you a break or give her a break or add at least something in to be a little different might be helpful.
You think she would be okay with that?
Well, I mean, what if it was somebody like me?
Oh, well, if it was you, that'd be fine.
Okay. I'm going to pause because what am I recognizing with Rachel's validation when I validate Rachel?
Well, you learned more information.
I did. What else am I figuring out?
I think you're figuring out more about why I'm saying things and maybe what I've tried, maybe what some possibilities are to see. So it's a little bit more of a problem solving sort of thing.
Yeah. And for me, what I'm realizing is Rachel's as stuck as her mom right now. Because Rachel's tried some things, but it doesn't seem to be working. And so Rachel's sort of stuck. And by validating and hearing what she was saying, I'm coming to a better understanding. Rachel's sort of right now, she doesn't know how to move anything. And she's feeling stuck, literally stuck in the relationship, but not being satisfied with the relationship. And if we don't start thinking differently about this, my friend Rachel is going to start having more and more problems because she's going to get real frustrated that I'm spending all my time running the store for mom and she doesn't want to. And actually, that's going to impact our relationship. So maybe it's worth me spending a little energy and time to say, tell you what, let's try something. And let's see what happens if I come over and we decide to go out together. Because, I don't know whether it'll change anything or not, but at least we'll have more information. What I'm really saying is maybe it's time to bring in a third party to get some support for you. Because at this point, you're frustration with things not working the way they used to could lead to more arguments with your mom or giving up. And neither of those things are going to be great for you nor your mom. So as a friend or a family member, I have a choice. And my choice is either I change something or I'm not being very helpful. But for me, it also means, do I have the time? Do I have the energy? Will I make this commitment? And if I can't, who do we know that might? Because what I'm hearing is that Rachel is feeling, I need some help. I need help because I think what I'm saying is accurate, but I don't know what to do with what I'm saying. What about you?
I agree. I also think that I also use a lot more skill in my part too, because I was not the distressed, quote unquote, unreasonable family member who is just in distress and can't do anything. I was fairly calm and reasonable. And so that made a difference where we could have a conversation. And the fact that I opened up to you kind of says, I want or need someone to talk to and think through this.
And I wasn't fixing anything. I was saying, well, let's try something to see whether or not it shifts anything. So what we're talking about here is building community and building skill in members of the community. And this idea that, well, you know, I don't have anybody living with dementia that I'm working with. It's like, I don't have to have somebody living with dementia to see the value of some skills that we learn so that I can support somebody I care about who happens to be somebody who's working with somebody who's living with dementia. Or it could just be that maybe that isn't dementia. Maybe it is depression. Maybe it is anxiety. Maybe it is something else. But it doesn't make it any less real or any less valuable to support the individual. So,
well, the other thing is, if I talk to you and you don't do this and you do dismiss me, then why would I open up and share anything else with people? Because then it isn't safe. So then you end up in the Lone Ranger. And encouraging that, or at least if you listen and at least are there for me, then at least you're not abandoning me.
I'm not abandoning you, and I'm not actually letting go of a relationship, because if I don't know how to help Rachel and if I don't know what to do, then Rachel will stop seeing me as a friend or stop seeing me as a helpful family member, and things start to fall apart. And that happens way too often. Our goal with what we do is to say, let's bring community together. Let's share this thing that's going on and let's work forward with it so we all can live better, because I don't need to lose another friend. I don't need to lose a family member simply because we don't have the skills to validate what's happening. So building your validation skills, building the ability to listen openly, hear, and then consider options and alternatives, and work with the partner that you have, the friend, family member, and say, I'm not sure, but what if we try something?
So validation is a fancy word for taking people seriously, right?
Yeah, and maybe listening fairly well and staying curious and authentically wanting to provide support and help.
And caring about people.
Yeah.
Friends don't abandon friends.
Well, not good friends. Nah. So till next time, take care with your care and hopefully find somebody around who is willing to listen, because it does make a difference.
A big difference.
A big difference. Hey, everybody, it's Teepa
and Rachel
for one final version before we head off from Indianapolis, which will be long gone from by the time you watch this. But
we were actually together.
So our topic for this session, we're going to talk about validation, but we're going to actually talk about validating the person living with dementia who's having experiences and really reinforcing that idea of listening to someone with curiosity, authentically wanting to empower them, but also being aware that my perspective and your perspective on something might be very different. And you don't have to agree with me to acknowledge and recognize what I'm saying. And there is a difference between, yes, you are a great driver and you've always been a great driver. Seems subtle, but it's actually really important, because acknowledging I've always been a great driver is accurate. You don't need to say, but you're not anymore in this moment. Because if I'm looking for validation, and I'm having some trouble with being in the life that I'm in and what's going on in my life, then I simply need you to listen. You do want to be careful that you're not agreeing to support something that you truly believe isn't safe, isn't okay. And that's where people can sometimes get flustered or frustrated and think, well, but I don't want her driving. It's like, well, neither do I. If she's not safe driving, I really don't want her driving. But there's a difference between validating a sense about my driving and saying, yeah, you should go drive. Well, we'll play with it a little bit and see what happens, see what you figure out. And if we mess up, we'll come back and talk again, because that's what we do. So Rachel, I wanted to ask you something.
Fire away.
So, since I got my diagnosis, I've about decided for a while that, actually I still can do a bunch of stuff, that this wasn't going to keep me down and keep me limited. I was going to still do things I like to do. And so I was going to play pickleball. And I thought, I know how to do this. I can do this. And when I got to the cart, see, that's what I'm saying. When I got to the cart, because it was a court. It's court.
It's close.
No, well, it wasn't close. It was cart versus court.
Well, you got to the pickleball court.
Yeah, well, but then, now what was the thing I was going to tell you about it? See, this is what I'm talking about. I find that when I go to find a thing that I want to say, and I make a error, that then the thing I was going to talk about disappears in the meantime while I'm doing the thing that I couldn't think of.
So, well, but you're still pretty good. You can still.
Yeah, but this is different. What I'm saying is, whereas before, when I first was doing this, and it wasn't too bad, that, it really wasn't, and I was able to go, but then this time it was just like, boom, it was like a big boom where, I don't feel like all of a sudden it was like, I couldn't think of things that I could typically. And so this is like, then I'm like, oh my, this is it. This is the thing everybody talks about, getting dementia. See, before I didn't have dementia. At least it didn't feel like I had it. And now this feels like I do. And
so could you play pickleball, or could you just not play?
Oh, you're not listening. You're not even understanding what I'm talking about.
Well, I am listening to you.
Well, you're not listening to me because you're talking about pickleball and I'm talking about having dementia.
Well, you said you had a hard time thinking of the things that you were doing.
So we'll pause because Rachel's really trying. Rachel? It's really hard because by what I'm worrying about and what I'm thinking about, if you just keep following the conversation and trying to figure out the conversation,
I feel like I'm always behind you.
You're always behind me because what we're doing is we're working on details and specifics, and you're trying to figure out what I'm talking about, not what I'm trying to share. So we'll try it again, only we'll try it with maybe a little more validation, which is going to feel a whole lot more comfortable for Rachel. How, Rachel?
Yeah.
She before we started, she said, do I have to do this? It's like, no, you're the one that suggested.
I forgot about that part.
I wasn't advocating for this. You were the one that said we should do one for the person living with dementia.
Yes, we should.
Okay.
But not the bad part.
But not the bad part. Well, but that's the reason we're doing it, is because when we talk about how important validation is, this is the bad part. If you don't do it, and you can think you're doing it, because Rachel.
I was not being mean. I really was not being mean. I was listening to you. I was being really nice and sympathetic.
You were, but you were not meeting my need, which is the thing about the difference between validation, truly listening to what somebody is trying to share with you emotionally, spiritually or practically. I'm trying to practically share something with Rachel. You really got to listen, and there's some skill involved. You have to develop your skill. And it's not just repeating the words. It's not just repeating words. It's really listening. So let's try it again. So Rachel, when I first got my diagnosis, it really wasn't bothering me. It really wasn't bothering me at all. I mean, I get, yeah, I mean, I knew I had it because there were just signs that I was having it. But then yesterday I went to the cart, the pickleball court. See, and I, what was I talking about? I mean, see, this is no. I mean, what happens is when I go to find the thing, then by the time I find the thing, the word, then I can't.
Where you're trying to go.
Yeah,
And
I lost where I went to go, and that, like, so the example that I was trying to come up with is when I was at the
court,
the pickleball court, and this time when I said it was that I could only find the wrong word when I did it. So instead of court, what did I say? The
cart.
The cart. Yeah, and then when that happened, it was like my brain got shocked or lost or something, because then I couldn't remember what I wanted to tell you about
the first.
Why I bothered to talk about the
well, it sounded like you were talking about how the symptoms weren't that obvious in the beginning,
right,
and now they're becoming more.
Yes,
apparent.
And it was a shock because I thought, I'd be able to keep doing the thing as I was doing, because it really, I'm not working anymore. It's not like I'm working anymore, but I am doing things. But then things like the surprises keep happening, and it makes me I don't know. I don't know whether or not am I making it worse by doing things, or not worse, or what? I'm not even sure right now what to do with that whole idea.
Because you're trying to do things because that's a good thing.
Yeah.
But then when you do, you end up with these, you said surprises, but I'm guessing they're nasty.
Well, yeah, they're nasty because I get, ugh, what do I do? Because then I'm afraid, okay, well, now I can't remember what I was going to do. And the memory thing hadn't been that much a problem, but it's when I can't find the words. And then when I find the words, then I can't remember what I was going to say about the words.
But I would have to think that would have to be terribly frustrating.
Well, it's sort of scary because it's like all of a sudden, like, gosh, I'm having more trouble. And if this is how it's going to be, this is, ugh, I don't like this idea at all. But I can't tell if I'm doing it like if what I'm doing is making it worse. Like, know what I mean?
Yeah. So trying to figure out not to make it worse. At the same time, you don't want to just stop doing everything just because. So
it's like, what do I do differently so that if the wrong thing comes out, that I need to not be so caught on that I can't.
It's like you get stuck.
Yeah. And then, yeah. So how do I not do that?
So if you're coming up with a word and you can't come up with it, it sounds like that specific word gets in the way of the basic idea of where you're trying to go.
Well, yes, except that when I come up with the wrong word, it's even worse. Like, what was the thing I said? Cart. Yeah, cart versus court. So see that, but then I can't, that sort of like, then it rear ends me or something. So then it's like, so what was I going to do there? Because that's, so why was I even at the place that I was at?
Yeah. So do you think it would help to write down ahead of time why you're going somewhere? Or
Well, I haven't tried it. I don't know.
I don't know. I was just thinking if you looked at it, would it help kind of jog back?
Oh, I don't know. I guess I could try something, but I'm afraid I won't remember to do it. You know what I mean?
Yeah.
I don't know, but it's really irritating.
Can I ask you a question?
Yeah.
How is this working? Like us talking, are you getting that frustrated?
No, I'm not getting frustrated with you or anything. It's just I just when I'm out doing something, it's when it like it just makes me then wonder whether I should or I shouldn't. And then I feel maybe I'm getting so like wishy-washy.
Oh, I had an idea.
What?
What do you think if we partnered? And that way, if you got stuck on the word or something and got derailed, then maybe someone could kind of been like, okay, so Teepa, we're here to play pickleball.
Oh.
Or here's where I think you were going. And maybe, what do you think about that possibility?
I hate to bother you though. I mean, because you're busy.
Well, what happened if we tried it just to see what would happen?
So it wouldn't necessarily always be you, but
Maybe some other people could do it.
maybe though, but maybe it's time for me to not try it on my own anymore.
I don't know. That's a hard thing to do. And I don't know if that's a good idea.
Yeah.
And I hate for you to give it up altogether.
Yeah, I don't know. Yeah, okay. Well, okay, so we need to think some more.
I think maybe we should think about it and see what we can come up with.
Okay. So I'll pause. So Rachel, how did that feel?
That was much better.
That was better.
What do you think?
I mean, it was definitely better. I was more able to sort of try to process through what's bothering, what's scaring me, what's making this hard, and what really I'm confronting. And this is often something somebody living with dementia has to confront. Can I do this on my own, or do I need a partner? And do I want a partner? And how hard? I mean, if I keep pushing myself and it keeps not working, what happens then? But if I have to have a partner all the time, so it is a hard place to be. I mean, it is a really hard place for somebody to be. But at the same time, without somebody to talk to, it certainly doesn't make it easier to be there. And if I'm struggling to find words and the person that I'm with is not really, they're just busy giving me the words and they're trying to help it move forward and get me the answer. Well, I'm not sure there is a great answer for me. But being present with me is going to help me at least think about things a little differently and realize I have a friend that I can talk about this to. It's not like there's not taboo subject. It's not like she's going to run out and get me signed up with 3 different people to take me to pickleball or this or that or whatever. It's just a possibility that we can move something forward to try it. And I think those are the magic words. I think I might need some help. What could we try? And so it's building these relationships that sustain abilities, don't demand too much, but also recognize how hard this is to have to be non-independent, if I've always been that way. So any final thoughts?
So I was curious, did you feel like you're on your own now? Or did you feel like you at least had someone with you in this awkward place?
Oh, I figure we're going to at least make one trip to the pickleball court. We'll see what goes on. But, it's like you've been open to it. So I'm curious what would happen if I had a partner to go out with. How would it feel? How would it be? And we won't know the next step until we try something. So helping me get to a place of being willing to try something, even if it's just, let's have another conversation. But you know what? Why don't we have it out at the pickleball court?
Or maybe I could watch and see what happens.
You can watch. Why going to where I did it before might be a helpful thing.
Well, for me, it would be helpful if I could come and watch you do it, because it would give me a lot more information as far as maybe I could see where you're getting stuck, what's happening, what may be happening versus what you're picking up on, you never know. And so there's
Yeah.
a possibility of getting a bigger picture. What are the people at the pickleball court like?
Mhm.
How open are they? How friendly? What's being asked of you? So just a lot of pieces that I could learn a lot more information that way.
Yeah. And what's really different for my brain is being in a different location where the issue is happening may cause my brain to fire in a way that actually does allow us to explore what's really going on, which we're trying to explore here in this space, in this safe space where we have this conversation. I'm sitting, she's sitting, we're not moving, we're not trying to think and walk and talk at the same time. It could give us better data, as Rachel says, to make better selections or choices or come up with new things to give it a try with. So we can get out of this loop that we're in, that I'm feeling stuck, I'm feeling scared, I'm making my world small. I'm thinking about making my world smaller because I don't want to do this. This is real uncomfortable. But we won't know until we try. The good news about dementia is if I can find a good friend that makes me feel comfortable, I can try stuff. We still haven't decided for sure what's going to happen next because we don't know what's going to happen next. But being willing to try something with a friend is a big step.
I don't know what's going to happen either. So that's true for both of us.
I don't think any of us know what's really going to happen. We may think we can predict the future, but life happens. And we try to figure it out from there. So if you're someone living with dementia, you're a friend of someone living with dementia, you know someone living with dementia, and you think maybe it's time for a conversation and you're not sure what to do, let us know because we will provide support. We can be that third party that sometimes helps when somebody gets stuck. We can be the person who maybe works on some skills with one or the other of you or both of you. And sometimes we can be that second set of ears that the person living with dementia may not be able to find out there in their world because they don't have family or friends that are listening very carefully. They have a lot of people with opinions. All right, everybody, till next time, take care with your care. Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching. And if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.